Understanding informed consent in healthcare practice. Understanding informed consent. Informed consent represents a fundamental patient right and legal requirement that ensures patients understand and voluntarily agree to medical treatments. Definition: the process by which patients voluntarily agree to medical procedures after receiving clear, adequate information. Purpose: protects patient autonomy and rights while ensuring understanding of risks and benefits. Legal foundation: prevents legal conflicts and supports ethical healthcare delivery. Patient empowerment: enables informed decision-making about healthcare options. Essential components of informed consent. Valid informed consent requires 5 key elements that must be present for legal and ethical compliance. Disclosure: healthcare provider must explain the procedure, risks, benefits, and alternatives. Information must be complete and presented in understandable language. Patient must receive answers to all questions and concerns. Comprehension: patient must understand the information provided. Language barriers must be addressed with professional interpreters. Education level and cognitive ability must be considered. Competence and voluntariness: patient must be mentally capable of making healthcare decisions. Decision must be made without coercion or undue pressure from others. Patient must have time to consider options without rushing. Documentation: consent must be signed by patient and placed in medical record. Witness signatures may be required depending on facility policy. Date and time of consent must be clearly documented. The nurse's role in informed consent. Nurses play important supporting roles in the informed consent process while recognizing their limitations and responsibilities. What nurses can do: verify that patients have received sufficient information from providers. Ensure patients understand what they are consenting to. Witness patient signatures on consent forms when appropriate. Advocate for patients who have questions or concerns. Notify providers if patients appear unclear or hesitant about procedures. What nurses cannot do: explain risks and benefits of procedures, provider responsibility. Obtain informed consent on behalf of physicians or surgeons. Sign consent forms on behalf of patients. Make treatment recommendations outside scope of practice. Pressure patients to consent to procedures. Who can provide informed consent? Understanding who has legal authority to provide consent helps ensure appropriate decision-making processes. Adults who can consent. Competent adults aged 18 and older. Emancipated minors who are legally independent. Patients with designated healthcare proxies or power of attorney. Special considerations for minors. Minors under 18 generally require parental or guardian consent. Exceptions include emergency situations, pregnancy-related care, mental health treatment, and STI services. Emancipated minors can consent independently. Cannot provide consent. Unconscious patients without advance directives. Patients with severe cognitive impairment or dementia. Minors without parental consent, except specific exceptions. Patients under the influence of drugs or alcohol affecting judgment. Special considerations for minors. Minors have unique considerations regarding informed consent that nurses must understand and navigate appropriately. Parental consent requirements. Generally required for medical procedures and treatments. Both parents may need to consent for major procedures. Legal guardians can provide consent when parents are unavailable. Exceptions to parental consent. Medical emergencies where delaying treatment could cause harm. Reproductive health services including STI treatment and contraception. Substance abuse treatment and mental health services in some states. Pregnancy-related care including prenatal services and delivery. Emancipated minors. Married individuals under 18 years of age. Financially independent minors living separately from parents. Military service members regardless of age. Minors who have obtained legal emancipation through courts. Exceptions to informed consent. Certain situations allow for medical treatment without formal informed consent processes. Emergency situations. When patients are unconscious or incapacitated. When delaying treatment would result in serious harm or death. When immediate intervention is necessary to save life. Implied consent. For routine, non-invasive procedures like vital signs or blood draws. When patients voluntarily present for routine care. For generally accepted nursing care activities. Waived consent. When patients voluntarily refuse to receive detailed information. When patients specifically request not to know procedure details. When cultural considerations make full disclosure inappropriate. Court-ordered treatment. When judges order treatment for patients refusing life-saving care. In cases involving mental health commitments. When public health requires mandatory treatment. Verbal versus written consent. Different types of consent are appropriate for various procedures and treatments based on risk and complexity. Verbal consent. Appropriate for minor procedures with minimal risk. Examples include routine injections, basic wound care, or medication administration. Should be documented in patient record. Written consent. Required for high-risk treatments and surgical procedures. Examples include surgery, blood transfusions, chemotherapy, and invasive diagnostic procedures. Must include all elements of informed consent. Implied consent. Assumed for routine, standard care procedures. Examples include taking vital signs, basic hygiene assistance, and routine assessments. Ethical issues in informed consent. Several ethical concerns can complicate the informed consent process and require careful nursing attention. Common ethical challenges. Coercion or pressure from family members or healthcare providers. Language barriers requiring professional medical interpreters. Cultural considerations affecting decision-making processes. Patient literacy levels that may impact understanding. Mental capacity questions requiring legal representative involvement. Nursing responses. Ensure decisions are truly voluntary without external pressure. Use certified medical interpreters for non-English speaking patients. Respect cultural values while ensuring adequate information sharing. Adapt communication to patients' educational and comprehension level. Recognize when patients lack capacity and involve appropriate representatives. Legal implications of informed consent. Understanding legal consequences helps nurses recognize the importance of proper consent procedures. Consequences of missing consent. Battery charges for unlawful touching or treatment without permission. Malpractice lawsuits when patients suffer harm from non-consensual procedures. HIPAA violations if sensitive information is shared without authorization. Professional disciplinary actions against healthcare providers. Legal protection strategies. Always document consent procedures properly and completely. Ensure patients demonstrate understanding of procedures and risks. Advocate for patient rights if they appear confused or pressured. Follow facility policies and state laws regarding consent requirements. Seek supervisor guidance when consent issues are unclear. Cultural considerations in consent. Cultural backgrounds can significantly influence patient approaches to informed consent and decision-making. Cultural factors. Some cultures emphasize family decision-making over individual autonomy. Religious beliefs may influence treatment acceptance or refusal. Language differences require professional interpretation services. Trust in healthcare systems may vary based on cultural experiences. Culturally sensitive approaches. Respect family involvement while identifying the actual decision maker. Use professional medical interpreters rather than family members. Allow adequate time for cultural consultation and decision making. Acknowledge and respect religious or cultural treatment preferences. Collaborate with cultural liaisons when available. Summary and professional responsibility. Informed consent protects patient autonomy and safety by ensuring understanding of medical procedures and treatments. Patients must receive full disclosure and demonstrate comprehension while making voluntary decisions. Nurses play supporting roles through verification, advocacy, and documentation without obtaining consent themselves. Consent exceptions apply in emergencies and specific minor situations, while legal representatives provide consent for incapacitated patients. Key takeaways for practice. Informed consent is both a legal requirement and ethical principle. Nurses support but do not obtain informed consent. Patient understanding and voluntary agreement are essential. Cultural sensitivity improves consent processes and patient relationships. Thank you for learning about informed consent. Your understanding of this process helps ensure patient rights are protected while supporting safe, ethical healthcare delivery.